Hi, everybody. Dr. Joan Ifland here. Today, I have so much good news for you. I am going to show you how to control your healthcare costs. I know you've heard lots of stories before, but you have not heard this one, and I am so excited to be sharing this with you. Who am I? I am a PhD, MBA. I'm a fellow of the American College of Nutrition. I'm CEO of Real Workplace Wellness and our other online communities, the ARC. And most importantly, I am the editor author of the textbook for the field of processed food addiction. So I am here to collaborate with you on a new approach to controlling your healthcare costs that I think you've never seen before. I hope you're excited. We are going to be looking at breakthrough approaches. This is absolutely new, what I'm showing you today. I have a patent pending on it. I have been assured by a person who spent their career evaluating healthcare systems that what I'm proposing here is not found anywhere else. So I hope you're getting excited. The existing option in wellness programs and healthcare is to support your employees in the traditional approach of medicating diet related chronic illnesses for a lifetime. And as we all know, that's costing a fortune. The new option, which I'm going to propose to you today, is to structure a work environment where employees are empowered to put chronic illnesses into remission. And in the course of that, just as a bonus, employees will become healthier, more productive, and I think they will become very loyal to you. People just don't know that they can put a lot of chronic illnesses into remission. So this is the dreaded chart that we all just roll our eyeballs. What are we going to do about this? These are public and private healthcare costs. They are clearly out of control. The green line is private and the blue line is public, and it is just going up and up. And it has been since the 1980s, 1990s. Well, here is the breakthrough. And almost 29 years of research. I've been at this since 1996. I have done the research, I've earned my PhD, I've written the textbook, and now I'm going to present to you a model of where those healthcare costs come from. They start with craving triggers, cravings for processed foods. That's step one. Cravings become stronger over time. Every time you have a craving, every time you address that craving with processed foods, it becomes stronger until those cravings are overriding control. Step three is you get chronic consumption of processed foods, and I'm going to show you just how damaging these processed foods are. The good news is that we can come back out of these diseases. And now we have epidemics. We're going to talk about these epidemics of diet-related diseases. Most people are turning towards traditional medical approaches, but these are lifestyle-based. They're not because of a missing pharmaceutical or because of a lifestyle. Because we turn to these traditional medical approaches, now we have soaring healthcare costs, and it's just tragic. And we have on the horizon, we have Ozempic and Wegovy, and these could end up accelerating healthcare costs even more. They cost $300 to $1,300 a month. 2/3 of weight is regained in the first year we come off of them. And in the study that I'm citing here, improvements in heart disease return to baseline in those 2 years, in the first year after giving up the pharmaceutical. So they're not an answer. And we know that workplace wellness programs are not working. Businesses are spending $50 billion a year worldwide on wellness programs, but employees are getting sicker and healthcare costs are skyrocketing. This is the point of this presentation, which is there is a blind spot. There is something that these wellness programs just aren't seeing. And resolving obesity is not the answer. Yes, obesity co-occurs with all of these diet-related diseases, but just losing the weight doesn't necessarily put other diseases into remission unless you're giving up the processed foods in order to do so. So processed foods are the driver. I'm going to give you the evidence for that. And in this framework, wellness programs are not working because they don't address processed foods, and particularly cravings for processed foods as the root cause of healthcare costs. So this is the blind spot that we're going to be talking about today. It's processed food consumption. It is a key driver of chronic illness and therefore healthcare costs. Now, in the US today, Americans are eating almost 3/4 of their food in processed foods. They're not getting very much real food. And not surprisingly, 93% of Americans over the age of 20 suffer from at least one of these diagnoses: high triglycerides, blood pressure, blood glucose, or obesity. And in 2020, 1.7 million Americans died from this. And that was more than 5 times the number of people who died from COVID. But what are the media outlets screaming about? They're ignoring this. It's quite profitable, as we're going to see. There's the rise of obesity in the US, 1960 to 2018. That red line that you see there, that is the year, the range of years when the tobacco industry entered the processed food industry, and it brought with it a cravings business model where you have a product that's not worth anything, but you can hide craving substances in it, like nicotine and pyrosine in cigarettes. They came right over into processed foods, and they started hiding craving food substances. This chart shows that in 1970, well before the beginning of the obesity epidemic, people were already eating a lot of flour, shown in the blue, and sugars, shown in the orange, and frozen potatoes, those are French fries, and high-fat dairy. But by 1997, after tobacco enters the processed food industry, you see that Americans are eating over a pound per person per day in the US of these substances. I'm not going to call them foods because the body doesn't interpret them as food. This is a 37% increase from 1970. And with it came epidemics of obesity, diabetes, heart disease, stroke, cancer, memory loss, learning disabilities, etc. To me, this is the end of the story. This is what we need to focus on. This is the only thing that changed in the American diet. The consumption of beans did not change. The consumption of meat did not change. But you see, in this era, when obesity was really taking off, the big increase in consumption was flour. This orange transforms from sugar to high fructose corn syrup, French fries, and high-fat dairy. So I'm sorry this chart is a little bit complicated. We're just going to focus on this gray line. This shows the shift from minimally processed to ultra-processed foods. For men and for women, the increase is quite dramatic. You see exactly what's happening. This is the result. This is a stunning slide. I'm going to spend a few minutes on it. but it shows the mortality that is associated with eating processed foods. So the yellow line, let me describe the study structure. At baseline in year zero, this is a group of researchers at a big university in Spain. They took food diaries. They divided the population into people who were eating more than half their food in processed foods versus less. So the yellow line is people who are eating more than 50% of their food in processed foods. The purple line is people who are eating less than half. And they started going back every year, and they recorded the number of people in those two categories who had died. By the second year, by year 2, you can see already the people who are eating more of their processed foods are dying at a greater rate. By the end of the study, 14 years later, there's a dramatic difference between the people who have died, the people who are eating more than 50% of their food in processed foods, versus the people who are eating less than 50%. And of course, we are well in the United States on average. We're eating 73%. So this is just a dramatic illustration of what I'm going to show you next, which is if you can recognize that processed foods are the root cause of illness, you've got a chance. This is the mechanics of how processed foods create disease and early death. Processed foods weaken cell function. They deprive cells of nourishment on the one hand, and on the other hand, they're putting great demand on the cell. The cell develops insulin resistance, mitochondria dysfunction, inflammation, glycation. Autophagy means the cell loses its ability to clean itself. There's oxidative stress, membrane dysfunction, and epigenetics, where the environment is changing the way the cell works. And this is Rob Lustig's work, and it's described in detail in the book Metabolical. So now you have weak cells weakening the body's systems: inflammation control, glucose regulation, brain regulation, circulation, metabolism and digestion, hormone regulation, nutrition, immune function, fat accumulation, nerve function, filtering, musculoskeletal repair, genetics. The cells that run these systems are not performing, and therefore the system is not performing. The body's ability to keep itself healthy is compromised. So when you combine these weak systems, you get all kinds of illnesses. These are 20 common chronic illnesses: diabetes, hypertension, obesity, sleep, cancer, multiple sclerosis, osteoporosis, arthritis. And then the brain is not firing in a regulated way, which means you get depression, anxiety, stress, attention deficit, learning difficulties, Alzheimer's, dementia, stroke, eating disorders. And the organs start to stress and underperform, which gives you heart disease, kidney, liver, bowel, lungs, and reproductive problems. I know this is a lot to take in, so let's just take a deep breath here. This is the result of the control systems, the repair systems in the body being unable to function because processed foods have weakened the cells that produce, heartbeats and glucose regulation. The cells are not strong enough. They're not healthy enough. They're not vigorous enough to run those systems, and therefore we're having these diseases. So processed foods are driving these poor health outcomes. How do we know? Well, this is a chilling graph. It's quite explicit. The axis is unprocessed foods percent of calories. So in this study, they took their population and they determined how much processed foods people were eating. The y-axis is how likely they are to get diabetes. It's just crystal clear. The greater percentage of food you're eating in processed foods, the greater your risk of getting diabetes. Until right around here, around 60%, it's almost 100% that you're going to get diabetes. Here's two other charts, very similar. The risk of death from colorectal cancer and from lung cancer. The more servings of processed foods you're eating in a day, the more likely it is that you will die from these cancers. Okay, so step 2 in this process is recognize the opportunity. So just flip the coin. If we know that processed foods are weakening cell functioning, weakening systems, and resulting in chronic illnesses, let's flip the coin and say, oh, well, if you took those processed foods out, what about remission? Most people don't know that there is a pathway to remission from these chronic illnesses because they're being told by their doctors who are trained by the pharmaceutical industry. They're good-hearted people, but the pharmaceutical industry is telling them that no, there's no cure for these. Your patients have to be on medication for the rest of their lives. So these doctors are telling us that. But I'm going to show you a pathway to remission today. So regardless of the food plan, research shows us that health improves on real food. Whether you are on a keto food plan or a carnivore food plan or a plant-based food plan or a paleo food plan or the Mediterranean diet, all of these studies, all this research shows that you get improvement. These are big, some of these are big review articles, which means they looked at a lot of different studies. All these food plans work. But what do they have in common? Whether it's keto, carnivore, plant-based, Mediterranean, or paleo, all of these food plans eliminate processed foods. No processed foods. Very little. In the Mediterranean program, there's a little bit, but not much. So, step 3, what are we going to do? How are we going to help our employees realize that there is a pathway out of remission, a pathway to remission? Here we go. We're going to use counter marketing. Here's how it all started. When the tobacco industry came into processed foods, they brought with them the 5 A's of the craving business model. So the practices are, the 5 A's are advertising deceit, available everywhere, affordable, addictive substances hidden in the product, and starting with a young age. Now, in cigarettes, the advertising deceit was that cigarettes are sexy and rebellious and sophisticated. Available everywhere was accomplished through vending machines, convenience stores, grocery stores, and making it affordable. So before the taxes started being applied to cigarettes, you could buy a pack of cigarettes in 1950 for 25 cents. Addictive substances hidden. The tobacco industry extracted nicotine and put it back into the cigarettes to make them addictive, and then they added pyrosine. And the young age of onset for cigarettes, it was the Joe Camel cartoon campaign is the most blatant. They were going after 10-year-old boys. They took that model and they applied it to processed foods. The advertising deceit in processed foods is that they are convenient, cheap, and healthy. They are none of those. It's not convenient to be sick. It's not cheap to be sick. They are available everywhere because those vending machines, convenience stores, grocery stores, they just switch them over to processed foods. Affordable, they advertise these dollar meals. You're driving home from work, you get a dollar meal, and now your cravings are totally pumped up for the rest of the evening. The addictive substances that they piled into products, where we saw the slide of the vast increase in flour, high fructose corn syrup, French fries, and high fat dairy. Well, those are all craving substances. They all can trigger the pleasure pathways in the brain to crave. And they took the Marlboro Country Store craving development business model, and they explicitly, in their internal documents, describe turning it into the Kool-Aid wacky warehouse to addict very small children to sugar. So this is where the opportunity is. We can go into a workplace and provide counter marketing. We know how the processed food industry is stimulating cravings in our employees, and we know how to intervene in that process at very specific points with very specific programs. And that's the exciting news. So we counter the advertising deceit by educating employees about how processed foods are related to chronic diseases, and then how chronic diseases can be put into remission. Part of the deal is to teach employees how to make large quantities of real food in their homes, how to read a restaurant menu to find real food, and if you have a cafeteria in your business, how to make real food the easiest food to get there. And it has to be affordable. So training people to make affordable menus is part of the counter marketing, and also educating people about the true cost of processed foods. Yes, that dollar meal looks cheap, but is it going to trigger cravings that you're going to be spending money on in the evening? And are you going to be spending money on copays? Are you going to be losing money because you are sick from them? And all these things that are hidden in the deceit. The real food is free from craving ingredients like the high fructose corn syrup, excessive salt, excessive fat. And we do need to support our employees in how to protect their children. We got lots and lots of strategies for that. So these are just business practices. Every business has their business practices to create repeat business and to create profit. And in the food industry, they use processing methods that use sugar, fat, salt. And these ingredients may be subsidized, which keeps the cost of manufacturing low. But as we're seeing, these craving substances can also promote overconsumption and chronic illnesses. So, like many businesses, processed foods depend on repeat purchases, low cost of production, but the evidence suggests that this could be making your employees very sick. The US government, of course, protects these manufacturing practices because wheat, corn, and sugar support the economies of many states. So these bars and sweets and pastries and chips and pizza and bread and donuts support the US economy. But the evidence is that they are making your employees sick. My bottom line on this is big food and big pharma are eating your profits. And it's not the employee's fault. Until they get a lot of skills to protect themselves from these craving practices, their frontal lobe, their wisdom, I know better, why am I not able to? It's overridden by the flood of cravings from the pleasure pathways. But I also want you to know it's not management's fault either. Management is being saddled with responsibility for something that is incredibly hidden, that is so profitable to the medical industry, to the processed food industry, to the weight loss industry, even the fashion industry, the entertainment industry, that nobody really wants you to know how to get out of this. It's not management's fault either. But what we're saying today is use this new research to stop it. You can stop it. So here's your step 4. How do you go about this? Teach employees to focus on processed foods. Education, trigger avoidance, real food availability, and belief, understanding. No, I know that doctor told you you're going to be in pain for the rest of your life. You're going to be on these medications for the rest of your life. But I think the pharmaceutical industry is treating doctors deceitfully as well. There are pathways to remission, but they don't make money for anybody. This is the pathway to reducing the need for healthcare utilization. So here are some of the things that management can do. Empower leadership through knowledge. When the leadership knows that there are pathways to remission of these chronic illnesses that make the employees suffer, that can trickle out to the rest of the organization. Teach employees the connection, the cause and effect between processed foods and chronic illness. We all have this vague idea, oh, this is not really good for me, unless it's labeled as healthy, which can happen. But the idea that this is causing pain, when you really get that deep on the inside, then you can use a natural human force called pain aversion. But until you know what's causing the pain, that's not available. Sharing stories of success makes this real. Creating new workplace norms. So in my workplace, it's normal to eat real food. And this is a huge relief to a person who goes out into the real world where it's normal to eat processed foods and be sick. But if you can create a norm, make it normal, oh, we eat real foods here and we're healthy, then you have given that employee a huge gift of being able to eat real and feel normal at the same time. We want to integrate and extend existing wellness programs. The running of the counter marketing is essential. We're going to reframe incurable conditions. And of course, while we're doing all this, we're going to deeply respect employee privacy. No more blind spots. I'm going to show you 3 cases. These are real cases from our online support community. This happens to be me. I've had brain seizures and I've maintained remission. I have recovered fully and beyond from a brain injury, recurring sinus infection, asthma, allergies, raging depression, anxiety, PTSD, fatigue, brain fog, joint migraines, skin growths, poor sleep. These things have all gone into remission from eating clean and working on managing stress, emotions, thought control, etc. You're watching this on a video, so you can pause the video and read this list if you would like, and this list. So it's really fun when somebody gets off of processed foods for them to keep a remission list, because we forget we had these things. But it's freedom. You're getting free from these processed foods, and you're getting free from all of these conditions that you were told were incurable. So it's really fun. I mean, it's really exciting. I felt No, so I got off of just sugar and flour in 1996, and oh my gosh, I felt like I'd won the lottery every day, as these things that I had suffered from for a lifetime, as they just started fading away and fading away. It's really exciting. Okay, so no more blind spots. The drive is to empower employees to shift from processed foods to real foods, to start putting chronic illnesses into remission. So it's not this vague thing, oh, you're going to feel better. No, we have real pathways. So what does the employer do? Just lead by example, that this is a calm process. We're not judging. No, it's a process, and it's a calm process. Some days processed foods are going to get into our system no matter how hard we try, but we're going to stay calm about it and work our way back to real food. The employer provides communication channels. We have tons of information. We have, well over 100 videos. I'm making this video in 2024. I'm coming up to 29 years of experience in this field. I've listened to thousands of food addicted people. I've read thousands of studies, and we now have a match for what people need to know and what will help them, what skills they need, what understandings. And so our material is well proven, well tested out. Facilitate access to real food, either by training employees how to make nice big quantities of real food, or providing them on your premises if you have a cafeteria. And then affirm employees in their efforts, so that when they do, they come up, they're going to be so excited. Oh, my A1C, they might not want to tell you, but if somebody does, my A1C is so much better. Then you say, yes, good job. You know what that employee has done in order to produce that improvement in their diabetes. Okay. So what we can do, help at every step, research-based education on cause and effect. I'm a PhD. That means I'm a researcher. That means that I give the evidence. I work from studies. I am not making anything up. We have mitigation of cravings, triggers. We teach employees it's the cravings that override your rational thought. So we teach employees how to mitigate the triggers. Craving management skills, real food menus, and real food prep skills. Training and supportive communications, so that your employees can communicate to their households and get their households well as well. And then we do have backup programs. We have our online programs that provide higher levels of support for people who just need that extra surround, kindness and compassion and training to get the cravings to stop and get control over their food consistently. So what I'm proposing is that we co-create. Let's co-create a custom turnkey program. You're going to tell us how you run your business. You're going to tell us how your employees work best. What do they like? And then we will use our singular expertise to customize a program for your workforce. We do claim that singular expertise because of my work on the textbook. I am a fellow of the American College of Nutrition because of my work on the textbook. And we have a patent pending, as I mentioned. So we are singular in the field. We have strong credentials. That PhD is in addictive nutrition. And we're so excited about the opportunity to work with you. So we are your partner. We participate with you in the risk and reward. We are focused on reducing your healthcare costs. It's not some kind of feel better, fuzzy program. We're tightly focused on relieving your employees of the suffering of these health crises that result in cost to you. So together we can succeed. Do reach out to me. That is my cell number. Text me first so that I know who you are. Or you can email me at joanifland@remissionoptimistic.com. I can't wait to hear from you. I appreciate you, and I'm so grateful that you are out looking for an answer to your employees' health.